Again, I am happy to be here. I want to first and foremost thank you for being here with me and inviting me to be part of the Engineers Week. I will be looking for a few minutes on the occupational safety and health in terms of COVID. So this is what I want us to just consider because COVID is a new normal, and we will be so in terms of my presentation here, it will be quite brief. So in terms of the outline, we'll be looking at an introduction in terms of looking at what COVID has done for us and what some of the things in terms of COVID, so that we're basically on the same page. Then we will look at some of the consideration in terms of workplace, and then I will end by looking in more detail in terms of the best practices for the International Labour Organization in terms of what they recommend as best practice. So COVID, as we all know, is is a respiratory illness caused by the novel coronavirus, SARS virus, and some of the symptoms include fever, cough, difficulty breathing, and nasal or congestion, running nose, and so forth. It is spread very generally through the droplets when a infected person coughs or sneezes, and this droplet ends up on the mouth, nose of persons nearby or is inhaled. One of the best prevention technique is to avoid being exposed to this virus. However, as you know that we now are facing community spread, so we are indeed, it is necessary for us to avoid. Sometimes prevention is the only cure, and as we don't currently have a vaccine for the COVID-19, persons are working on that, but that is not yet available. So we have to, in the best way, wear our masks, sanitize, and quarantine persons. So I did a quick look at the statistics for Jamaica, and this is what is on the Ministry of Health and Welfare website this morning. In terms of the parishes, we see that, of course, Kingston and St. Andrew have the highest number of confirmed cases, and followed by St. Catherine. However, in terms of recovery, more persons have recovered. Nearly half of the persons who was exposed on confirmed cases to the COVID-19 in St. Catherine have recovered, followed, of course, by Kingston and St. Andrew. Notice that it is important that we take the necessary precaution, because being exposed to COVID-19 has caused, right now to date, 46 deaths. It is changing on a day-to-day basis. Notice too that more female than males, about 55% of the females who have persons who are contracted are female. So we need, and it is reason to that, mainly because generally it is a female who are the caregivers, and therefore they're more exposed. And another thing too, that persons who have comorbidities like hypertension, who have diabetes, and so tend to be more susceptible, more at risk of getting COVID. So as persons get older, it is likely that they will have the comorbidities and so forth. So we have to take the necessary precaution. So generally, in terms of the considerations that we will be looking at today, is I put into three major categories: general, hygiene, and then engineering. So some of these are the strategies that we'll be looking at. So in terms of consideration, and many persons have done this intuitively, but in terms of return to work, who would return to work, and then we look at the assessment in terms of the job, the task, and the physical environment. So we'd assess the person's risk and then prepare the workplace for return. More places are opening, and so, but in terms of the return, we have to consider the cleaning, sanitizing, and disinfecting, as well as social distancing, and persons who are coming on would be required to wear a mask. Then we would look at what is our IPC policy in terms of infection prevention and control. So the company, what policy the company has in place, more persons more or less follows the Ministry of Health and Wellness protocol. So that is what, and we have to train persons, have persons trained in carrying out these activities. One thing that we have not done is that we don't consider the mental health, the effect of the mental health of COVID on workers. So it has caused, in many cases, the psychological problem. So we have the distress persons are. So because of COVID, we have to be more or less socially distant, covering up, protecting ourselves, because especially in this case, it has started in terms of the community spread. So more persons are likely to get it. As you'll see, notice that in July we were about 1,000. Now by September, August, we are at 4,000. So it is getting here. One of the things in terms of the prevention and control that we need to consider is what I consider job safety analysis. So we look at the jobs, what the hazards are, I evaluate the risk, and then look at how we can control it. So we do that for the various steps, so in terms of the job safety analysis. In terms of the hygiene consideration, one of the things that we have to do, and Ministry of Health and Wellness have always been saying that, is that we will need to look at our personal hygiene. So in terms of washing our hands properly. One of the things that is recommended with soap and water, that is we use soap and water to wash our hands properly. If we can't do that, then we will use a hand sanitizer with have about 60% and more, at least 60% alcohol in it. We need to look at our respiratory hygiene. So if we have to sneeze or cough, we would sneeze in a tissue, discard that tissue, and in a closed container, and wash our hands properly. So one of the other things that we have to consider in the workplace is that, and now persons who are doing the cleaning and so forth, the janitors have to be cleaning more often. So that is one thing we'd have to consider. What are the PPE, the personal protective equipment that we need to have on, and especially now with COVID, we have to wear a face covering, a mask or so. So it's important that we wear the mask. All right. But in terms of engineering control, there are various strategies that we would use. We have 3 major strategies. Well, we can't eliminate it right now, so we have to look at how we can control it. So we use it in terms of the hierarchy, we use engineering, administrative, then last but not least, personal protective equipment. So the engineering control really look at the source by physically changing the process or the work environment. So some things that we can do in terms of COVID is we put in barriers. I noticed that more and more places are using plexi screen and sneeze guard, and persons have the face shield that they are wearing now. What we need to also do, especially in the high touch areas, we want to consider hand-free door openers, soap and towel dispensers, trash receptacles, especially the one that you operate by your foot. You don't have to lift the lid. So one thing I've learned though is that for high touch points, that copper or copper coated tape, copper is resistant to the spread of the coronavirus. So we need to consider that, but we will need to consider creating a space, isolated workstation. Persons have considered working from home and so forth. So we look at that part of it. So in terms of an action plan, we need to start from home. So we gear up before leaving home, make sure we have our masks, our sanitizers, and so forth. If you have to take in terms of the transportation, if you have to take the public transportation, like the bus or the taxi or so, we have to ensure that we wear a mask, and we need to, by the time we reach work, look at areas. So we have what we call the symptom screening. So more persons have the infrared thermometer that can give you an idea of whether or not this person has a fever, right? So based on the temperature, we would just do a temperature check and make sure that the areas are not congested. So we ensure we're on the checkpoints. We have to make sure that we have that. When we're at work, we need to consider how we arrange our process, what we have to do in terms of the meetings and in terms of the travel. So we have to more or less consider to be a part. Sometimes we can also, what we can do in leaving the work, have designated exits, entrance and exits, or we can stagger the exit time. So persons have done that. But what I will be looking at more so is what we consider, what the International Labour Organization put out there as best practice. We have done some of these things, and persons have done some of these things intuitively. So there are 10 best practices, and we'll be looking at them shortly. So number one, first thing that we do is to set up a team, and the terms of reference of this team is to develop a work plan to organize the safe and healthy return to work. That most persons are doing or have done, but we need to make sure that this team is aware of the national measures and guidelines. So some of them, for our case in Jamaica, we have the disaster risk management and order. And I put here the latest version because it is changing on a day-to-day, month-to-month basis, as the case may be. Once we have so the Ministry of Health and Wellness have to, they put those in place to help us. So some of the measures that the public health control measures, as I have said before, and the one they are doing now is carrying out contact tracing, ensuring that persons are quarantined. For persons coming into the island, I understand it's 14 days, so they have to stay in the quarantine. They recommend sanitizing and disinfecting places, so the killing, not just sanitizing. Sanitize brings the to acceptable norm, but disinfectant really deals with more or less killing the germs. So the Ministry of Health have put out some protocols in terms of these things. All right, so once we have decided, so set up the team, we have decided who should return to work. So we look at what our policies are, so identify the critical staff and look at make sure that we deal with the high-risk groups of persons who are 65 and over, who have pre-existing comorbidity, that they, as they call it, persons who have health conditions. So I mentioned before, diabetes, hypertension, workers who are pregnant, female workers are pregnant or breastfeeding. These persons are in the high-risk category. So in terms of the measures though, we would consider the physical interaction and physical distancing. So we want to be 6 feet apart. So make sure, so we want to promote persons who can work from home should do so, and recommend that that is the case, especially now that we are having the community spread. We need to reduce the physical contact between persons. We would consider installing physical barriers and partitions. So we have, especially where workers share the workspace, we need to have that physical barrier. And for those persons who have to interact with customers or suppliers or even visitors, so you have to put those in place. We would also need to and could assist by putting out some markings so persons are aware. So you need to put on the mask before you enter, or maybe you want to organize a workplace with 2 lanes, so so you minimize this sort of contact. Look at persons who have to take the elevator, so maybe you have to look at minimizing, because now, for example, the elevator, you might say 13 persons would be should not have more than 13 persons. Now you may have to consider having 4 or 5, reduce it by 50% or more, so as to ensure that you have this separation. In terms of ventilation, we would recommend, and the Ministry of Health has done so, that you ventilate the place and use natural ventilation as much as possible, especially if you have a shift system, you ventilate it during that change of shift. So you sanitize and ventilate, use a process. Make sure that you maintain the air conditioning system. So we have that. Avoid the concentration of workers. So you want to look at staggering if it's a shift system, staggering the start and the end of the system. All right, so there's 4th best practice that the ILO have mentioned is that we need to have the clean. So we have persons now considering deep cleaning. So once you have a case where persons have contracted the disease, we have to carry out the necessary deep cleaning, and we need to inform workers and other parties related to that in terms of the timetable and increase the frequency of the cleaning and disinfecting of the facilities. Note, in terms of personal hygiene measures, it is recommended that we use hand sanitizers that contain over 60% alcohol. But note too that this has happened is that we need to warn persons to dry their hands properly after they have used the alcohol. because as you may be aware, you might have heard, a person got, after using the hand sanitizer, got burned, severely burned, when they strike the match to light the stove. So in the case of that, note two is that in terms of personal hygiene measure, we discourage the wearing of rings, watches, bracelets, because they limit the effectiveness of the hand hygiene measure. So we have to ensure that we are warn persons in this regard, right? So that they are aware. The other things that we have done in terms of number 6 is to identify what is the appropriate personal protective equipment. So wearing the mask, wearing the face shield, and also train persons how to put on and take off properly and safely. And also they need to make sure that they clean, disinfect, and store the PPE. I know that persons are wearing masks, and in the mask that they're wearing, they're not covering the nose properly. In fact, some persons say it's stifling them, so that they wear the mask below the nose. That is actually defeating the whole purpose if you do so. But from time to time, persons need to know when they have on the mask, they need to take off the mask for a while in a safe place and breathe the air, get some natural ventilation, and so they have there sort of, and then you put on back the mask. So that will help. So persons need to be aware of that. Health surveillance. You have noticed that persons have been using a handheld thermometer. So the person's temperature, body temperature, should be below 38, so that once they go above that, they're going into the area of the fever. So they need to make sure, so you need to know. So even when the persons do the check, the temperature check, you need to know, they need to tell you what it is. So that will help you or guide you. Sometimes the temperature, because you're out in the sun, may be a little high. So you need to ask that person to step aside and cool off a little more and then recheck. Monitor persons as those you know who are high risk. Monitor them. Make sure that they are taking their medication with properly and consistently. Keep this information though confidential. And we want, as the Ministry of Health has been promoting, we don't want any discrimination of persons who are suspected or are confirmed to have COVID. But we need to know, so that we can take the necessary precaution and the necessary measure. But we don't. They make sure that the information that we have are confidential and keep the confidentiality. So the 8th one is that persons don't recognize that because of COVID and because of the separation, persons are not able to cope. So you are having distress. So we need to know and identify what the behavior changes are, and provide, as much as you can, persons counseling services, so that persons who need it. Promote an area in which is free from violence and harassment. And again, we need to implement the necessary IPC measures, especially when you have chemicals are stored, and chemicals and how they use the chemicals, because the chemicals can be misused, and then we have a challenge in that regard. We have in your plan, if you want to review and update the plan, so how we are going to the exits, what are the assembly points, look at the number of workers that need to gather at the point or to assemble. Right now, according to the Ministry of Health guideline, we should have no more than 15 persons gathering in at a particular point. We need to discourage the gathering. But in the case of an emergency, persons, we need to revise that plan so that persons are aware that they need to go to the assembly point and stay at the assembly point, but still maintain the 6 feet apart distance, all right? So as not to transmit the virus. So in all of this though, we need to recognize that we have, because of the new normal, we have to review periodically, monitor or control measures to see if they are working. And the next thing that we need to do, we need to document any changes that are necessary. So we want to maybe, in case of the risk, they avoid it as much as we can, or we can reduce it by wearing the mask. We don't want to transfer it to nobody else. We want to minimize, so that we want to secure everybody's safety and health. So we want to recognize that before anything else. So we want to put those things in this regard. So in a nutshell, I have said that we have looked at what are the workplace considerations, how it is transmitted, and how we can protect ourselves. And then we look at the ILO best practices in this regard. So ILO have done some things for us. We don't have to reinvent the wheel, so we can look at what these measures are. And so in a nutshell, how we can best protect ourselves. I thank you. If you have any questions, I will take them at this time.
All right. Thank you very much. We have one simple question. And Peter Spence is asking, how often should we remove the mask?
Each person's, I would recommend that if once you start to feel a little, so each person is different. So that's what so it's not a standard in that regard, but I would recommend that you remove the mask for a 5-minute period. So like, for example, if you have it on for half an hour, you remove it for like a 5 minute from time to time, depending also on the activity that you're doing. So if you climb the stairway, right, with the mask on, it's going to impact your breathing. And so if you're once you have done so, you find a safe space away from other workers and remove the mask for a 5 minute and then replace it. Remember, you need to use the handle of the mask. So you want to try to avoid touching your face and so forth and touching the front of the mask. So in that regard, but make sure that the mask cover both the nose, from the nose down to the chin, right? So that in that regard, that's what I would recommend.
All right, thank you very much, Mr. Dale. For any other comments or any other questions, we'll ask Mr. Dale to answer them directly. But for now, I'll turn it over to now Engineer Ricketts.
All right.
Thank you very much again, Mr. Andrew Dale, for a very informative and presentation. We have, it's good that you came at this stage, because although in maintenance, the topic today is maintenance, engineering, and management. And a part of management is how to implement our maintenance plan within this COVID, what we regard now as the new norm. So thanks again. And there's a key issue that you mentioned, that this COVID is causing behavioral change. or behavioral changes. So this is something that we have to bear in mind while we execute our maintenance plan throughout our different industries and plants. So thank you very much again.
You're welcome. All right.
I just want to thank our sponsors. I mean, before we wrap up, we want to thank our sponsors, HTG Engineering and Consultant, NO White and Associates, Premier Land and Water Development, and those were our gold sponsors. Our silver sponsors are Isratech, National Works Agency, GDM Associates Limited, SCL Jamaica Limited, Conrad Douglas and Associates Limited, Quality Plus Contracting Company Limited, and MJ Tools and Equipment. We thank them all, and of course our supporting sponsor, Spur Open, that facilitated all this broadcast virtually. So we thank our sponsors, we appreciate their engagement, and to facilitate us having been able to present this conference in this new way. Now, I also want to recognize and thank our participants, because if we hadn't had our participants, this would not be a beneficial meeting, a beneficial conference. So we thank our participants over the past 3 days and more so today. Our presenters for this morning, thank you very much. And President Engineer Sparks and the Planning Committee, the Chairperson of Conference, Engineer Melissa, and her team, we thank them very much for this new norm, this new way of producing and delivering this conference. I now hand over to the Chair of Conference, Engineer Melissa.
Thank you, President-elect Engineer Ricketts. Well, we have come to the end of a very good interactive week of engagement with our fellow engineers and wider public. But I must say, when planning this event, the team for weeks mulled over whether to have this event or not, even trying to decide what kind of format given the new restrictions and risks. But we remember that we are engineers, that we are problem solvers, and it is indeed instructive that in keeping with our engineering expertise, that we were able to navigate and adapt in this COVID-19 environment and deliver quite effectively the offerings for Engineers Week. The week started out with a church service at the Boulevard Baptist Church, where we were well received. The service was also shown virtually. Our present engineer, Natalie Sparks, in her remarks to the congregation, outlined the work, the worth, and contribution of engineers. Over the past 3 days, we have been engaged in very informative, inspiring, and relevant topics surrounding our theme for this week, which was reaffirming engineers' importance to development, which is also the theme for this council year. On Monday, we were pleased with the lively discussion about the state of productivity in Jamaica and how we have to be innovative throughout our daily work practices, especially with COVID-19. We also discussed about 5G and COVID-19, even how to combat COVID-19 with big data and artificial intelligence. Yesterday, we delved into infrastructure development and environmental engineering and received a full synopsis on port development, coastal protection, and even how to create modern new towns. And now today, I think we are fully abreast with creating safe working environments and maintaining our buildings and workplaces, particularly our healthcare facilities. Next, we would have had our site tour and student competition. We know some persons were disappointed with the omission of these events. We merely did this in interest of safety of our fellow engineers and wider public. But not to worry, we have more events to come. So I have to take this opportunity again to thank those who were involved in the organization of the week's activities. Of course, President Engineer Natalie Sparks, the Engineers Week Committee, council members, other members who came on board like past President Gary Walters, Michael James, he's the past president of the student chapter at UTEC, former council member Anthea Reynolds, Martina Enova, and our secretariat, of course, Ms. Campbell and Ms. Forrest. Thank you to all who presented. Thank you to our sponsors. Again, can't do it without them. We have HGG Engineering, NO White, Premier Land and Water Development, our silver sponsors, Isratech, NWA, GDM Associates, SCL Jamaica, Conrad Douglas and Associates, Quality Plus, MJ Tools and Equipment, and our supporting sponsors for Open for facilitating online payment for this event. And an even bigger thank you again to our attendees, our engineers, our budding engineers. Thank you for your support and participation. We can now truly move forward to express, concretize, and engage within the context of our theme of reaffirming our importance to Jamaica's development. So please look out for more workshops and seminars from the JIE as we continue to promote the practice and science of engineering. So thank you again for participating and have a great day.